Okay, good evening, everyone. Hi, my name is Dr. Thomas Pigott, and I am here along with Dr. Ukpe, and we will be giving a information session. This information session is on the new COVID-19 vaccine that has been approved for 5 to 11-year-olds, but we'll be here and available to answer questions more broadly as well. A number of questions have been sent in advance, so thank you very much for those, and we really look forward to the discussion, and we hope that this is useful. So we're going to talk a bit this evening, and we will do the following. We have an agenda here: COVID-19 and the benefits of vaccination, how COVID-19 mRNA vaccines work, the current situation in pediatric vaccine, as well as some frequently asked questions. But before I continue, I'm going to turn it over to our host for the session this evening, Chief Wei Tung. Chief Wei Tung, would you like to proceed? Thank you.
Absolutely. So if we could open the meeting just by welcoming everyone to the traditional territory of the Mississauga Anishinaabe, that would be great. I like to share a little bit about what that means. My grandfather would live to be 99, and he would have been 100 on November 30th. And so he would share with us the stories that his grandparents shared with him about the stories that their grandparents shared with them. So when we welcome people to our territory, we're recognizing the fact that our ancestors have lived in this area from as far back as anybody can remember. And my grandfather's father was a signatory to the Williams Treaty, and I believe that his grandfather was a signatory to previous treaties as well. So miigwech everybody, and welcome to the territory. Did you want me to introduce yourself and Dr. Ukpe now?
Sure, yeah. Thank you.
Okay. So I would really like to share with our community members some of the expertise that we're going to have access to this evening. It's really exciting to be able to bring this information to our community members. So Dr. Thomas Pigott brings experience working at various levels of public health in Canada and internationally. Most recently, Dr. Pigott has been a medical officer of health and VP lead for population health and rural and remote health in the northern region of Labrador-Grenfell Health. Dr. Pigott has experience in collaborative Indigenous public health in Canada and internationally. Through the COVID-19 pandemic, he led a response in solidarity with Indigenous governments in Labrador for outbreak prevention and a fair vaccination rollout, prioritizing Indigenous communities. Prior to working with Labrador-Grenfell Health, Dr. Pigott worked as a field doctor with Médecins Sans Frontières, Doctors Without Borders in the Democratic Republic of the Congo. Dr. Pigott is a public health and preventative medicine specialist and a practicing family physician who completed his master's in public health at London School of Hygiene and Tropical Medicine and residency training at McMaster University. Dr. Pigott is actively involved in research and teaching in public health at McMaster University and Memorial University. Dr. Pigott's research work has focused on guideline development and health equity. He was the co-editor of the book Underserved: Health Detriment of Indigenous, Inner City, and Migrant Populations in Canada, 2018. Dr. Pigott is a member of the GRADE Working Group and has advised in public health guideline development methodology for multiple organizations, including the World Health Organization and European Commission. In 2019, Dr. Pigott was appointed to the Provincial Health Accord Newfoundland Labrador Task Force Social Detriments of Health Committee to provide expertise on health system reform. Dr. Pigott has previously served on the board of directors of the Public Health Physicians of Canada and the World Federation of Public Health Associations, and currently sits on the board of directors of the Canadian Public Health Association. So we are thrilled to be able to have that kind of expertise joining us in our community. We're really, really glad to have you joining us in the county and city of Peterborough. Dr. Ukpe qualified as a Fellow of the Royal College of Physicians and Surgeons of Canada and American Academy of Pediatrics, also with certification in leadership and finance. An Associate Clinical Professor of Pediatrics, he functions as a consultant pediatrician. As a member of the Canadian Pediatric Society, he has served in the Public Education Committee, Self-Assessment Committee, and as an assistant editor of the Pediatric and Child Health Canada's flagship pediatric journal. He is widely published in electronic and print media. He was awarded a Certificate of Merit of the Canadian Pediatric Society for outstanding contribution to youth in his community and nominated for the Royal College of Physicians and Surgeons of Canada 2015 Prix d'Excellence Specialist of the Year Award for British Columbia, Alberta, Yukon, and Northwest Territory. A student of nature and an enthusiast of astronomy, he studies the Grail message and contemplates fundamental questions of life. He is the author of Only Be Afraid of Standing Still, Practical Lessons from the Lives of Children, and currently working on more manuscripts. Dr. Ukpe is involved in global health and has widely traveled with his family. So we are also thrilled to have that kind of expertise on the line with us this evening. But I think possibly most importantly, both Dr. Ukpe and Dr. Pigott are parents, and so they have a real connection to the types of concerns that our community members in general have, and a thorough understanding of what it means to be vaccinating a population in the middle of a pandemic. So Miigwech for joining us and sharing your expertise, and I hope that we are able to answer everybody's questions this evening. Miigwech.
Thank you so much, Chief Weetung. Real honor and a pleasure to have you helping and hosting and facilitating this session this evening. And I'm so sorry, at least on behalf of my biography, which is way too long and ate into our time for the session here today. But yes, I'm Dr. Pigott. I'm your new medical officer of health, and really looking forward to the session today. And as I understand, at least for those of you joining by the live stream, it might not be possible other than if you can text Robin questions. We can probably get a hold of some questions real time. But otherwise, I think we just have a number of questions, quite a number of nice questions that have come in. So we'll go through those. And I'm going to start speaking, and then I'll turn it over to Dr. Ukpe to speak as well. We have a nice mix. I'm an expert in protecting the health of a population, and vaccines are really important to that. But also, Dr. Ukpe is an expert in child health as a pediatrician and knows a lot about vaccines. Their benefits and the potential side effects. So I think between us, we should be able to answer your questions. And Dr. Ukpe, feel free to chime in if you want to add as I'm going through. I think we can bump off of each other fine, and I'm very easygoing. So I'm sure if you have something to add, it's welcome. So the first thing that I wanted to talk about is just to reiterate that COVID-19 has had a disproportionate impact on Indigenous communities. And part of this is historic and ongoing trauma. But as a result of national prioritization from NACI, the National Advisory Committee on Immunization, Indigenous populations have been prioritized throughout the pandemic. The next thing that I want to mention is that the virus COVID-19 is continuing. This pandemic is continuing. It's nearly 2 years now, as all of you know, that we've been living with this pandemic. And so far around the world, there's been almost over a quarter billion cases and over 5 million deaths. The concern around variants with SARS-CoV-2 virus is that there has been different forms of the virus evolving over time, with the latest being Omicron, the virus variant of concern that you are now hearing about in the media. It is a bit too early to know exactly what we are dealing with this variant. But it is reason for prudence, but not panic. It is reason to be really aware of the measures that we need to be taking. And it's all the more reason to get vaccinated, but it is not not reason to panic. At this stage, we are really watching things closely, and certainly from my perspective, as the medical officer of health, we will take actions that we need to take to continue to protect the health of the population. Vaccination is just one of many tools to help prevent against this pandemic. They are all still very important, including distancing, wearing your mask, limiting gathering sizes, and what is very important as well that I want to emphasize, especially going into the colder months, winter in Canada, is air circulation. Because a small but important component of this virus is transmitted as an airborne mechanism. Opening windows, opening doors, if you're having guests over, very important, in addition to wearing your mask. And so you may wish to 10 minutes of every hour open a window if you are having guests over. It can help to really freshen and circulate air better. The benefits of getting vaccinated generally are that with the introduction of something that does not make you sick, your body learns how to respond to prevent you from feeling sick. And when you do actually end up potentially exposed to a virus, your body has a head start and can mount an immune response and either prevent you from getting sick altogether or prevent you from getting more sick. This is a nice visual just showing how this vaccine, which is called an mRNA vaccine, the one that we are using for most of the population, but especially now for the Pfizer 5 to 11-year-old vaccination. And mRNA, messenger RNA, is, as you probably know now that we've been talking about these vaccines for a long time, a small piece of information. I like to think of it like a recipe card. We give your body a recipe card for the virus. You can't get sick from the recipe card, but your body knows the recipe to make in case you need to respond to it later. It is injected into your shoulder, and that injected material helps your body to mount an immune response. Then if you are end up exposed, you will be able to recognize and destroy the virus much quicker. In the local level, we wanted to highlight a couple of things because the vaccine continues to be very important. And we have seen actually that people who are not vaccinated have almost 6 times higher likelihood of being very sick, 11 times higher likelihood of ending up in the hospital, and 26 times higher ending up in the ICU. So really this vaccine is very useful and important. And it is important because we are actually seeing rising cases of COVID-19 in the region. Every week for the last number of weeks, we've been seeing more and more, and we are going into the holidays. So I'm quite concerned, and I think getting vaccinated as soon as possible is really important. To speak about the pediatric vaccine for 5 to 11-year-olds, it has a lower dose than the adult vaccine. And that's because kids can mount a faster and more robust immune response. They can react better and they can develop a better immune response with a vaccine. And so we can give them a smaller dose of the vaccine. And the best benefit of this is it carries a lower risk of any of the adverse events, even though those adverse events are already quite rare in the first place. But it's very well tolerated. This vaccine has been very well studied. And there has been research done showing it's very effective and that potential side effects, other than a bit of a sore arm, are very rare. I am now going to hand it over to you, Dr. Ukpe, to talk a bit in general and a bit from some of the stories and experiences you've had discussing with parents about this vaccine.
Thank you very much. I noticed that we are both from McMaster, Thomas. So it means something good is happening out of there. That's number one. Number two, Chief Emily, thanks for welcoming me to your community. I'm really impressed. I've never seen a female chief before, so I'm still on the high about that. And for the rest of the people listening, this is only a first session for me. if you have more questions or you have things you want clarified, you can always get a hold of me through your family doctor. I'm available to ask questions. These days, I answer a lot of questions for people who already come to see me. My approach to vaccine is very simple because I know every parent wants to do the best for their children. So the reason why you are here this evening is simply to get the information that makes you, that gives you the power to take the best decision you can for your child. And the first question people normally ask me, why do the children have to have vaccines? Why isn't it enough that adults have vaccines? Because in my experience, many parents are ready to put themselves on the line, but they're a bit more cautious with their children. The simple reason is this: COVID-19 has happened in 4 waves. In the last wave, the incidence, the amount of COVID that happened was highest in the age group of 5 to 11. So if we don't deal with that age group, over time, nothing we do will matter. So it's absolutely important that that age group gets vaccinated. The vaccine has been found to be very effective, 90% of it. Studies have shown that the usual complications you hear about, myocarditis, pericarditis, are very rare in children. The side effects is just a sore arm. Some of them can be fatigued. But the biggest number of side effects I've seen is a sore arm. Children who have had COVID-19 can still be vaccinated because it prevents subsequent disease. There are people who say that instead of doing twice, you may want to do once. But I just finished a meeting with the Canadian Pediatric Society. The more vaccine you have with time, the bigger, the higher your level of defense. So if you have to do it twice or 3 times, that's something that is useful, but it has to be individualized. Another reason why children should have this vaccine is because of the people in the family. Many children have COVID-19, they don't notice because it's like a cold. They have a cold, have a sniffle nose, and they rub their noses and all that, they play around the place. But they come in contact with their grandparents, they come in contact with sick members of the family, and they become very dangerous to those members of the family because they transmit the virus. At times, they don't even know that they have the virus, which they transmit. And those people become very ill as a result of that. There is another reason: they have to be in school. If they're not vaccinated, and other children around them are vaccinated, they become the weakest link. Because remember, the virus is a living thing, it's trying to survive. So it's going to find a way to go to the person that is not that has not been vaccinated, because it's easier for the virus to replicate itself in that kind of circumstance. So in general, COVID vaccine is necessary for children between 5 to 11 years old. It has been proven to be effective. The side effect is minimal and is localized, and it is protective of the children, both as individuals, as members of families, and members of schools. That is the general theme of what I need to say tonight. And I'm happy to answer questions because they tend to vary with individuals. Thomas?
Yes, no, that's great. We can maybe just finish the slide and I can mention some of the questions and we can share here the questions. But first, I think I'll just turn it over to Chief Weetong about the questions. Please, sorry.
Thank you. I just want to remind everybody that if you do have questions that you'd like to ask, please feel free to text Robin if you have her cell phone number, or to give her a call at the health center right now, 705-657-2557. I'm just going to say that again, 657-2557. And Robin will make sure that Dr. Piggott or I get your questions, and we'll do our best to get you an answer. If it's not tonight, we'll get it for you certainly as soon as possible.
That's great. So I wanted to give you some practical tips around helping your kid, because if you are going to be getting your child vaccinated tomorrow or in one day in the near future, here's some suggestions to make it as calm as possible. And I want to reassure you that we've been thinking, and I know our partners have been thinking in the context of questions with regards to making it as comfortable as possible for children at the events and sites. This means, sometimes longer appointments and more space or more calming environments for kids. And we want to make it fun too. We have a superheroes theme because really, children getting vaccinated, we feel, are our superheroes of the pandemic right now. So if you're getting your child vaccinated, it's important to talk about it beforehand. Talk about why it's important, not just for their own health, but to be able to protect their family, protect their school, colleagues. And like Dr. Ukpe says, to not be the weakest link and to be safe. You can let them know that there may be a little bit of discomfort, but don't make things too anxious in advance, especially kids these age. So you can say it's almost like a little pinch or a poke, because that's really all they should feel. It's helpful to make it easy and quick when you get into the vaccine center. So a short sleeve shirt underneath the jacket is very useful. And if you have concerns about pain management, the healthcare provider or the pharmacist that's doing vaccination may have some other tricks on that. You can have the child either sit on your lap, facing towards you or away from you. You can hold their arm and be there really to reassure them. One thing I want to say overall, though, is that what I think is most important is, as a parent, trying your best to stay calm. You may have some concerns and fears of vaccination yourself. Your child will get this from you. And if you can instead try to stay as calm as possible and reassure them, but not overly reassure and ignore their fears. But if you can help to stay calm yourself, that will be reflected in your child. So we talked about staying very relaxed. I like a good distraction, maybe a toy, some music, a book, things like that can be really useful as well. And finally, if you don't have your appointment yet, here's some information. We'll be at Curve Lake First Nation on December 4th, which is tomorrow, and Hiawatha First Nation on December 11th. There will also be vaccinations provided by HKPR Health Unit in Haliburton, Cobourg, and Lindsay. And we have child vaccine clinics in Peterborough on the 7th and 14th. And you can see here about how to book those appointments. As well, you can talk to your healthcare provider or go to a local pharmacy that is offering the vaccine. Okay, so Dr. Upe, we've received several questions, and I know that Dr. Wheatung had mentioned one question already that we received. So maybe I will add this question. Now, can you still see me?
Yep, you flip up and down, that's okay.
Oh, okay, sorry. It's just because I was looking at the text message there. So apologies for that. So a question that we got through Chief Wheatung and Robin was, so now that Ontario is reporting about the white-tailed deer being substantial carriers of COVID-19, I wonder if we should put something about the meat being safe, but to be careful while removing the lungs or during harvest. Might be, for that piece, I think the risk from deer will still be extremely low. I do not know of any humans that have gotten COVID-19 from this. What I would say about about wild game, traditional meat, is that it can be a very healthy source of food for many people, and I wouldn't want people to be scared away from important foods for them. What you can do is there's a question about safety removing the lungs. It is probably very, very unlikely to become infected, even removing the lungs, because the way that COVID spreads is if somebody coughs or the breathing comes out and the virus is expelled out. And after an animal or even a person is dead, we know that the risk of getting the infection is very unlikely. The next question that we have here, maybe I'll turn to you, Dr. Ukpe. There's a question, my child has a heart defect and a malformation of the lung. Is there any concerns that they should be aware about with getting vaccinated, or could it perhaps be good for those children?
Yes, the answer is yes, it's good. It should be good for those children, because children who have pre-existing conditions like defects in the heart or defects in the lung, if they have COVID, they would be a lot sicker than children who don't have those conditions. So more than anything else, they should have their vaccination, and it's safe for them.
That's great. The next question that we received, here is similar question. Are there heart-related risks and concerns from having the vaccine? Did you want to start with that? They might be referring, Dr. Ukpe, to myocarditis, pericarditis.
That's
obviously
what
very
referring
rare.
to. And I've had a lot of those questions. So far, no. And the studies that showed that led to the approval of the vaccine for children 5 to 11 did not have any myocarditis or pericarditis. Theoretically, of course, it's possible, but the number did not allow us to establish that in approving the vaccine. It is rare in children, it's much more common in teenage years and in adults, but in 5 to 11 years of age, we haven't seen any, and is thought to be less likely than you would have in people who are older.
Yes, great. So that's it exactly. We know that there was 0 cases of pericarditis or myocarditis in the trial, like you mentioned, but we'll be watching, and Canada has a very good vaccine program where we watch very, very closely for any concerns around safety for the vaccine, but to date, we are not having them. And the other thing I will say is when you're thinking about potential side effects of the vaccine, those need to be balanced like on a teeter-totter against the benefits of the vaccine. And right now, where we're seeing lots of COVID and increasing COVID, the risks of the side effects are very, very low, and the risks of getting COVID and the protection you could get from the vaccine is really increasing and high.
Along
Okay.
those lines, Thomas, can I add something? Along
Please.
those lines of considering the side effects, the side effects of the vaccine is low, the risk is low, but even if they had it, it's predictable. You would know, you'll watch out for it, and you'll deal with it. The side effect of having COVID-19 is not known. All of it is not known. From what is known in the United States, people who have COVID-19, some of them recover very quickly. Some of them recover, but they have long-term complications. So when you are thinking of the complications possible of immunizations, you should think about the complications of having had the disease, which for some children may be very short, but you don't know what happens a year from now or 2 years from now if you've had the COVID-19. So that's something to think about when we weigh the side effects of a known vaccine and a disease that we don't know how it will affect a particular child.
That's really really nice explanation, Dr. Ukpe. Thank you. There's a couple other questions about the vaccine and the vaccine program that have come in that I might answer. And then certainly if you see any other questions, Dr. Weitung, just let me know. So there was a question here about the efficacy, how effective the vaccine is. And you can see on this slide, 90.7%. And that's in preventing any symptomatic COVID-19. And again, we didn't see any severe disease in people who were vaccinated. So this is really good news. And even if we are seeing some cases now, more cases of breakthrough COVID, what is really good about the vaccine is even if people who are vaccinated get the virus, they're very, very, very unlikely to get very sick or to die from COVID because the vaccine will still help and protect them.
Can you explain
another question
what efficacy means, Thomas, in a language that everybody understands, please?
Yeah, so that is how many cases are reduced. So how many people less get COVID because of this vaccine, right? So the higher the number, the better. If 100%, then nobody who gets the vaccine gets COVID. If 50%, half that get that vaccine get COVID. So when you look at 90%, that's an A or A plus grade. That's pretty good if we think about school grades. So that's what that means, and that's quite a good efficacy. And this is using the data from the new trial, the new study that was done for COVID-19. Another question that came was, my child is turning 5 years soon. Should they get the vaccine too? And so I'll speak to this because I'm sure people are anxious to find out if their kids are less than 5. At this point, it's only if your child was born in 2016 or before that makes them 5 years old in this year. So if their birthday to turn 5 years is not until 2022, so if they were born in 2017, they won't be eligible until the start of next year. If they're under 5 years old, this vaccine, we can't unfortunately use it quite yet for this population. And we are hoping to have a vaccine soon, maybe in months, not years, maybe several months, that will be approved for children under 5 years. At this point, there are studies underway looking at this vaccine in children under 5 years old, but they are not, unfortunately, available. The dose may be even lower for this group, which is good. It means that the side effects also may be even lower, and it will be very safe vaccine. But we're hoping in next year, at some point earlier next year, we may find out more about this vaccine for under 5-year-olds. Another question we got here, Dr. Upe, is just about what side effects should be considered normal and what should be concerning. Did you want to talk to that question?
Yep. Anything that has to do with soreness, local reactions, is considered normal. You have a small swelling, itchiness at the local reaction, and soreness of the arm for 1 or 2 days or 3 days more, that is normal. If you had a generalized rash, if there was something that looks as if there is an allergic reaction where you are having difficulty in breathing and those kind of things, that is not normal. And you should report that to the authorities. First of all, you make sure that the child is seen and addressed in an emergency way to stop whatever reaction the child is having. And then, of course, that has to be reported. But most so far seen side effects are things like feeling tired, soreness and tenderness in the spot. You may have some headache, a small fever, general muscle ache like you have had a flu. Those things have been recognized. But anything beyond those kind of things are things that you should report to your healthcare provider.
That's a great answer. Thank you. I'm just going to double check, Chief Weetong, any more questions coming in that you want to add? I have a few more on my list that we received, so you can keep going.
I do. I had one come in. If you have a child with a pancreas issue, is there any concerns that their immune system may overreact?
No. Pancreatic issues. Okay, I take a step back. It depends on the cause of the pancreatic issues. There are some autoimmune issues that affect the pancreas. But the pancreas is a victim, not the cause. So the child is not going to overreact to this as a result of the child's illness from having had pancreatitis. So in fact, it is that particular child that needs the vaccine, because if he has COVID, he needs all his organs to be functioning optimally for him to beat the infection. So instead of being afraid of overreacting, it will help protect that child whose pancreas is partially compromised.
Thank you.
Okay.
I have another one.
Sure, go for it. Yeah.
Okay. Someone with type 1 diabetes, which I understand is an autoimmune disease, and they're worried that getting the vaccine could have an adverse effect by causing an overt reaction of the autoimmune system.
That's very similar to the previous question. No, it's not going to cause an overreaction. Yes, if he gets COVID, he might be sicker than somebody who doesn't have type 1 diabetes. That's part of what is considered pre-existing and makes them more vulnerable. So if you have type 1 diabetes, you or even type 2 diabetes, heart disease, lung disease, Crohn's disease, ulcerative colitis, any of those chronic conditions, you are better off having the immunization because it helps protect you and helps your body fight the virus when it comes.
So it's better to get the vaccine because your body will recover better than if you get COVID and you don't have the vaccine and your body has to fight an infection.
Yes, especially when your body has to cope with other illnesses like type 1 diabetes.
Got it. Thank you. Those are all the questions that I've received coming in right now. If there's anything else, I can certainly pass it along.
Perfect. I have some more.
I have some more that we have to ask, right?
No, that's good. That's great. I have some more questions that we received. So I can go through. There's some questions about public health restrictions and the impacts, which I can answer. So one question was, will places start requiring youth to be vaccinated? And this is referring to under the age of 11. So currently, provincially, the proof of vaccination exempts children under 12, so 11 and under. We would have to consider a number of factors before we would require 5 to 11-year-olds, including availability and how much ability to get the vaccine there is and what the uptake is. And we would also obviously be considering the context of COVID-19. So they're not required at this point, but I anticipate that it could become required in the future. The same goes for sporting events or activities. At this point, it is not a requirement, and it's only a requirement if you're 12 years of age or older. I do think it could potentially change into the future. And again, especially a reminder, if you are going to be doing things like going to a restaurant, a sports venue, a cinema, if you're going to be flying, proof of vaccination is needed for all of these activities for 12-year-olds and older. And it could at some point become a requirement for younger as well. It's not now, but I think it's worth getting the vaccine now so that you're ahead of it. And when that requirement does change, your child will be able to access as well. We had a couple of more questions here. I think we made it through most of them. One question was, is there any data to suggest that girls are getting their periods earlier related to vaccines? There was some WHO reports that we looked at on this. Dr. Ukpe, I don't know if you want to comment, but there have been some reports to WHO of people perhaps experiencing their period earlier, but the WHO is continuing to monitor and look at this. At this point, there's not enough evidence and not a known connection, but there are some studies ongoing. Linked to this, there was question about does the vaccine impact fertility? And the answer is no. There's no evidence that it could cause any challenge or problems linked to fertility. I don't know if you want to add on either of those points, though, Dr. Ukpe.
No, for the first point about menstrual period, I'm not aware of any studies that documents that. I'm aware, though, that there are many people on the internet that come up with all sorts of things to try to frighten people not to get vaccines, like the fertility thing. The fertility one has been studied in the United States, and we've had COVID for 2 years now, and we've followed those who were vaccinated and young women of childbearing age who were vaccinated and those who weren't. There is no difference in the fertility rate.
Thank you, Dr. Ukpe. And the last question that I have here is, why has the interval between the first dose and the second dose of vaccine been extended? Some of you may remember that it was only 3 or 4 weeks if you are an adult when you may have gotten your vaccine many months ago. The interval has now been recommended to be 8 weeks, or the time period between the 2 doses is now 8 weeks. And that's a NACI, the National Advisory Committee on Immunizations, who we take advice from. That's their recommendation. And the reason is that there has been some more evidence that by giving it a little bit more time, your body remembers the immunity for a longer period of time better, and it's a stronger immune response. So that means the effectiveness, or how good the vaccine is at preventing the infection, is actually better if we wait 8 weeks instead of just waiting 3 or 4 weeks. So that is where that comes from, and that's why we are doing that with this pediatric vaccine. The first dose clinics are being planned now, and then people that are scheduled in will get an appointment for a second dose 8 weeks from now. And that is the last question that we received in advance. I will check, Dr. Witang, any new questions that we received?
No new questions.
Okay.
Can I just add, though, that Robin Steed, our Health and Family Services Manager, will be at the clinic tomorrow and has all sorts of information. And she and I have Dr. Pigot's number, so if there's any urgent questions or major concerns, come a little bit early to the clinic, take a minute to talk to us. We will find you answers, or we will find you a way to get the answers. We want everybody to have as much information as possible. So certainly happy to talk to families tomorrow if you think of something overnight, or later on. If you're not quite comfortable yet, but you've got other questions, feel free to reach out and we will help you get answers.
And if you have questions that are pertaining to children, give me a call anytime. I'll be happy to take the questions and deal with them. Because, and I'm saying this seriously, parents, I have been in business for a while. I have never seen a parent who doesn't want to do the best for their children. And it is in that light that I think they should be supported to make the best decision they can. Because if they take the wrong decision, I have seen parents beat up on themselves for a long time. So I'm quite happy to participate, to get the chief to call me, which will be a privilege. Then I get to hear from a chief, which I have never done before in my life. So I'm happy to answer any questions pertaining to the well-being of children.
Thank you so much, both of you.
Thank you, Dr.
Yeah.
Thank you, Dr. Witang, for the invitation and opportunity.
Absolutely. We're really grateful for the ongoing support of public health. Dr. Ukpe, thank you for your expertise and sharing that information with us. It's really wonderful to be able to bring this kind of information to our community. For far too long, we weren't given enough information to make informed choices about our health and well-being, and that was really our goal, is to bring that information to our community. So, Chimigwach, thank you very much.
Thanks for having